You go to bed feeling fine, your throat is clear, you're not congested, you fall asleep without any problem, and then morning comes. Within the first 10 minutes of waking up, it's back. That thick, stubborn mucus sitting at the back of your throat like it never left. Like everything you did yesterday, the water you drank, the foods you avoided, the nasal rinse before bed, meant absolutely nothing. Here's what's actually happening. While you sleep, your body runs a very specific set of processes that almost guarantee mucus will be waiting for you in the morning, unless you understand those processes and know exactly how to interrupt them. That's what today is about, not just what causes throat mucus, but why it comes back every single morning and the specific things you can do, tonight and tomorrow morning, to finally change that pattern. But before we go any further, I need to share something important. Everything in this video is for educational and informational purposes only. It is not medical advice, and it does not replace the guidance of your personal physician. If you have persistent throat symptoms that haven't improved after several weeks of self-care, or if you notice any warning signs like blood in your mucus, difficulty swallowing, unexplained weight loss, or a voice change that doesn't resolve, please see your doctor promptly. This video is meant to help you understand what might be happening and to give you better tools and better questions for your next medical appointment. And before we dive into the content, I want to ask you something. If by the end of this video you find this genuinely useful, go ahead and type the word morning in the comments below. Just that one word, morning. When you do, you'll find a pinned comment with a link to our free guide, The Overnight Mucus Cycle After 60, What's Happening While You Sleep and How to Stop It. It's a simple, printable resource that walks through everything we cover today in a format you can reference every evening as you build your new routine. No products to buy, no supplements recommended, just practical, organized information you can start using tonight. Type morning in the comments and the link will be there waiting for you. Now let's get into what's actually going on while you sleep. To understand why mucus keeps coming back every morning, you need to understand something that most people, and honestly, many doctors, never take the time to explain clearly. The mucus you wake up with in the morning is not leftover from the day before. It was produced during the night. Specifically, it was produced in response to things that happen to your throat and airways during those 6 to 8 hours of sleep that simply don't happen during the day. There are 4 distinct overnight mechanisms that contribute to morning throat mucus. Each one operates independently. Each one can be addressed specifically. And when you address all 4 together, the morning experience starts to shift in a way that addressing just diet or just hydration during the day never can. Let me walk you through each one. Overnight mechanism number 1, gastric acid migration during horizontal sleep. This is the most significant contributor to morning throat mucus in people over 60, and it operates almost entirely while you're lying down. Here's the physiology. The stomach produces acid continuously, including during sleep. Normally, a muscular valve at the junction between the esophagus and the stomach called the lower esophageal sphincter keeps that acid contained. But in the horizontal position, lying flat on your back or on your side, the mechanical advantage of gravity that helps keep acid down during the day is completely removed. After 60, that sphincter tends to lose some of its resting tone. Not dramatically, not enough to cause obvious heartburn in most cases, but enough that small amounts of stomach acid and digestive enzymes can drift upward through the esophagus and reach the throat and voice box during the night, especially in the second half of sleep when the sphincter muscle is most relaxed. The throat lining is exquisitely sensitive to acid, far more sensitive than the esophagus, which has developed some tolerance. Even microscopic amounts of acid reaching the back of the throat cause the body to mount an immediate protective response. That response involves producing extra mucus to coat and protect the irritated tissue. This happens silently. No heartburn, no waking up, no awareness at all. Just a steady accumulation of protective mucus in the throat throughout the night that reaches its maximum by the time you wake up. This mechanism explains a very specific pattern that many people notice but don't understand. Their throat feels worst in the first hour after waking, gradually improves during the morning, then gets worse again after meals. particularly after larger meals, coffee, or acidic foods. That pattern is essentially the signature of nighttime acid migration. There are also specific sleeping positions that dramatically change how much acid migration occurs during the night. People who sleep on their right side tend to have significantly more acid migration than people who sleep on their left side. This is because of the anatomy of the stomach. When you lie on your right side, the stomach's contents pool near the lower esophageal sphincter. When you lie on your left side, the anatomy keeps those contents toward the fundus of the stomach, away from the valve. Studies have shown that left-side sleeping can reduce nighttime acid exposure in the throat by as much as 70% compared to right-side sleeping. We'll get to the specific interventions for this in a moment, but first, let's cover the other three mechanisms. Overnight mechanism number 2, nasal passage drying and compensatory mucus overproduction. This one surprises most people because it seems counterintuitive. How does drying out lead to more mucus? Here's what happens. The nasal passages are lined with a moist mucosal layer that serves as the body's primary air filtration and humidification system. When you breathe through your nose during sleep, which is the ideal, the incoming air is warmed and humidified before it reaches your throat and lungs. But most sleeping environments, particularly in American homes with forced air heating or air conditioning, have humidity levels that drop significantly during the night. When indoor humidity falls below 35%, which is extremely common in heated homes during winter, the nasal mucosa begins to lose moisture. The thin, fluid mucus layer that normally moves freely thins out and begins to dry on the surface of the nasal passages. The body responds to that drying by doing two things simultaneously. First, it produces a thicker, more viscous mucus to try to protect the drying surface, which is the opposite of what you want. Second, because that thick mucus doesn't drain efficiently, it pools in the nasal passages and sinuses and eventually drips down the back of the throat, particularly when you shift positions during sleep or when you first sit up in the morning. That's post-nasal drip, not from infection, not from allergies, but purely from the mechanical effect of dry air on nasal mucosa during sleep. After 60, this mechanism is amplified by two additional factors. The cilia, those tiny hair-like structures that sweep mucus forward and downward in the nasal passages, function less efficiently with age, and the mucus glands in the nasal lining produce mucus with a slightly higher viscosity than they did in younger years, making drainage even more dependent on adequate moisture. Overnight mechanism number 3, mouth breathing during sleep. This mechanism is closely related to the previous one, but deserves its own discussion because it's both extremely common and extremely underrecognized in the 60-plus population. When the nasal passages are partially congested from any cause, including the mild inflammation from dry air that we just described, the body automatically shifts toward mouth breathing during sleep. This happens unconsciously, often without the sleeper having any awareness that it's occurring. Mouth breathing during sleep removes all of the filtering, warming, and humidification that nasal breathing provides. Air arrives at the throat cold, dry, and unfiltered. That direct exposure to cold, dry air causes the throat lining to become dehydrated and irritated over the course of the night. The body's response to that irritation is, predictably, mucus production. The throat lining secretes a protective layer of mucus in response to the drying and the direct air exposure. By morning, that layer has accumulated and thickened, contributing significantly to the familiar morning congestion. There's an additional layer to this mechanism that's particularly relevant after 60. Mouth breathing during sleep is strongly associated with mild sleep-disordered breathing, including the upper airway resistance that precedes diagnosable sleep apnea. If you regularly wake up with a dry mouth, if your sleep partner has mentioned that you snore or breathe loudly, or if you consistently wake up less rested than you expect given the hours you slept, those are signals that mouth breathing during sleep may be a significant contributor to your morning throat symptoms. Overnight mechanism number 4, the early morning cortisol surge and its effect on mucus production. We've talked about the morning cortisol surge in previous videos in the context of cardiovascular health, but cortisol has a direct and often overlooked effect on the airways and mucous membranes that's particularly relevant here. In the hour before waking, cortisol levels begin rising sharply as part of the body's preparation for the active day. That cortisol surge has multiple systemic effects, including an effect on inflammatory signaling in the airways. For people with any underlying airway sensitivity, whether from silent reflux, from postnasal drip, from mild environmental allergies, or from any of the causes we discussed, that cortisol surge can temporarily amplify inflammatory signaling in the throat and nasal passages. The result is a brief but significant increase in mucus secretion in the minutes before and immediately after waking. This mechanism explains something that many people notice and find mysterious. Their throat feels worst in the first 15 to 20 minutes after waking, before they've eaten anything, before they've had coffee, before any of the daytime triggers have had a chance to act. That extreme morning peak pattern is the cortisol surge, amplifying whatever underlying irritation is already present. It also means that what you do in those first 15 minutes after waking matters more than most people realize. We'll address this specifically in the morning routine section coming up. Now let's talk about the evening routine changes that address these four mechanisms. Because the overnight processes we just described begin setting up during the hours before sleep, and there are specific choices you can make each evening that dramatically change what happens during the night. Evening change number 1, the 3-hour rule for your last substantial meal, and why it matters more than what you eat. Most advice about reflux and throat mucus focuses heavily on what to eat. Avoid acidic foods, cut out spicy food, eliminate dairy. And while those choices do matter, research consistently shows that the timing of the last meal relative to lying down has a larger effect on nighttime acid migration than the composition of the meal itself. The stomach typically empties by about 50 to 60% within 2 hours of a meal. At 3 hours, most of the meal has moved into the small intestine, significantly reducing the volume of stomach contents available to migrate upward during sleep. At 2 hours, a meaningful amount of food and acid is still present. The practical target is to finish your last substantial meal at least 3 hours before the time you actually get into bed. Not the time you intend to go to sleep, but the time your body is actually horizontal. For most people who go to bed between 9 and 10, that means finishing dinner by 6 or 6:30. If that timeline feels difficult to achieve consistently, the compensating strategy is to keep the evening meal smaller and lower in fat. Fat slows stomach emptying more than any other macronutrient. A smaller, lower-fat dinner at 7 is meaningfully safer from a reflux standpoint than a larger, fattier dinner eaten at the same time. Evening change number 2, bedroom humidity correction. This is one of the highest impact, lowest effort changes you can make for the morning mucus cycle, and it's one of the most consistently overlooked. The target for your bedroom humidity during sleep is between 45 and 50%. At this level, the nasal mucosa stays adequately moist throughout the night, mucus remains fluid and drains efficiently, and the throat lining doesn't experience the drying and irritation that triggers protective mucus overproduction. A cool mist ultrasonic humidifier in the bedroom, not a warm mist vaporizer, which can raise the risk of bacterial growth and burns, set to maintain that 45 to 50% range will address the primary driver of mechanism number 2. The most important maintenance habit is cleaning the humidifier's water reservoir every 3 days. Stagnant water in a humidifier reservoir becomes a breeding ground for bacteria and mold within 48 to 72 hours. Running a humidifier with a contaminated reservoir introduces exactly the kind of airborne irritant that would perpetuate the problem rather than solve it. 3 days, empty, rinse, refill. For people who don't want to manage a humidifier, the simpler alternative is a nasal saline gel applied to the inside of each nostril right before bed. These gels, which are available over the counter without prescription, coat the nasal passages and help retain moisture during the drier nighttime hours. They're not a complete substitute for correcting room humidity, but they're meaningful, and they require nothing more than remembering to apply them each night. Evening change number 3, sleeping position optimization. Based on everything we covered about nighttime acid migration, there are 2 position changes that have the strongest evidence behind them. The first is transitioning to left side sleeping if you don't already sleep that way. As we discussed, left side sleeping uses the anatomy of the stomach to keep its contents away from the esophageal valve during the night. If you're a committed right side sleeper or a back sleeper, this transition can feel uncomfortable at first. Many people find that placing a firm pillow behind their back, essentially creating a prop that makes rolling to the right uncomfortable, helps them maintain the left side position during the first few weeks until it becomes more natural. The second is elevating the head end of your bed frame, not adding pillows, which flex the neck but don't change the angle of the torso. Actual elevation of the head end of the frame by 4 to 6 inches, using books, bed risers, or a wedge under the mattress at the head end. That elevation maintains the gravitational advantage that helps keep stomach acid where it belongs, even when the sphincter muscle is at its most relaxed during deep sleep. These 2 position changes together, left side plus head elevation, address the single largest contributor to morning throat mucus in the over 60 population. Many people notice a difference in their morning symptoms within the first week of implementing both consistently. Evening change number 4, the pre-bed nasal rinse. We covered nasal saline irrigation in the previous video as a general intervention for post-nasal drip. But the timing of that rinse matters significantly for the morning mucus cycle. Doing a nasal saline rinse immediately before bed, rather than in the morning or earlier in the day, removes the accumulated mucus, irritants, and inflammatory debris from the nasal passages right before the hours when postnasal drip is most likely to occur. It starts the night with clean, clear passages rather than passages already loaded with thickened mucus that will drip down the throat during the night. The technique bears repeating. Use previously boiled or distilled water. Never tap water directly. Mix with non-iodized salt and a small amount of baking soda to reach a comfortable pH. Use warm rather than cold solution, and afterward, gently blow your nose to clear the loosened mucus before lying down. Doing the rinse and then immediately lying down without clearing can allow the rinse solution to remain in the sinuses in a way that's uncomfortable. Now let's talk about the morning routine, because what you do in those first 20 minutes after waking determines whether the morning reset continues or begins to break. Morning change number 1. Don't clear your throat immediately upon waking. I know this is the hardest instruction in this entire video. When there's mucus sitting at the back of your throat, the urge to clear it is immediate and powerful. But here's what most people don't realize about forceful throat clearing. Each aggressive clearing motion compresses the vocal cords with significant force. That force traumatizes the delicate mucosal lining of the throat, and that trauma triggers, you guessed it, more mucus production as a protective response. The result is that forceful throat clearing provides 5 to 10 seconds of relief, followed by a new wave of mucus secretion that leaves you back where you started, within a minute or two, which leads to another clearing and another, until you've done it 30 times before breakfast, and your throat is more irritated than when you woke up. The replacement technique is a gentle, silent cough with your mouth slightly open, almost like clearing your throat with a soft sound, rather than the full aggressive clearing motion. Combine it immediately with a sip of warm water. The warm water helps thin the mucus and encourages it to move naturally rather than requiring the force of aggressive clearing. This substitution feels inadequate at first precisely because it doesn't provide that same immediate satisfying sensation of clearing. But within a few days of consistent practice, most people find that it actually manages the morning mucus more effectively and with less residual irritation than the aggressive clearing they had been doing for years. Morning change number 2. Warm water before anything else. The first thing that goes into your body in the morning should be warm water. Not coffee, not juice, not food, warm water first. There are three reasons this matters specifically for the morning mucus cycle. The first is rehydration. After 6 to 8 hours without fluid, the mucus that has accumulated during the night is at its thickest and most viscous. Warm water begins the rehydration process that thins that mucus and makes it dramatically easier to clear naturally. The second is temperature. Warm water rather than cold helps relax the smooth muscle of the esophagus and throat. Cold water can temporarily cause a mild constriction of those tissues that makes mucus clearance slightly harder. Warm water facilitates the natural movement of mucus downward and out. The third is the effect on the lower esophageal sphincter. Warm water in the morning helps reset the resting tone of that valve after a night of lying flat, making it less likely that residual stomach contents will continue to migrate upward during the first hour of activity. A cup to a cup and a half of warm or hot water, plain or with the juice of a quarter lemon if you find plain water unappealing, consumed slowly over the first 10 minutes after waking is a simple habit that addresses multiple mechanisms simultaneously. Morning change number 3, a 10-minute upright period before eating or drinking coffee. The transition from horizontal sleep to the upright position doesn't happen instantaneously from the body's perspective. The lower esophageal sphincter takes some time to return to its daytime resting tone after a night of lying flat. The nasal passages need time to drain the mucus that has accumulated during the night, and the cortisol surge we discussed is still peaking for the first 15 to 20 minutes after waking. Spending at least 10 minutes fully upright, not sitting reclined, but sitting straight or standing, before eating, drinking coffee, or beginning any other activity gives the body time to complete these morning transitions before adding new inputs. During those 10 minutes, the gentle throat clearing technique combined with small sips of warm water is doing active work. The accumulated mucus from the night is being thinned and moved. The nasal passages are draining with the help of gravity now that you're upright. And the esophageal sphincter is regaining its daytime tone. Coffee can wait 10 minutes. The difference that 10-minute window makes to the morning mucus experience, particularly for people with silent reflux as a primary contributor, is often surprisingly significant. Putting it all together, the complete evening and morning protocol. Let me give you the full protocol in clear sequential order. Starting the evening before, finish your last substantial meal at least 3 hours before you get into bed. Run the bedroom humidifier and target 45 to 50% humidity in the sleeping space. Do a warm saline nasal rinse immediately before getting into bed. If you don't already, begin transitioning to left side sleeping. And if you haven't already elevated the head end of your bed frame, consider that as a longer-term modification worth making. In the morning, when you first wake up, resist the urge to clear your throat forcefully. Use the gentle hum technique combined with small sips of warm water. Spend the first 10 minutes upright before eating or drinking coffee. Drink a cup to a cup and a half of warm water slowly during that 10-minute window, and allow your body to complete the morning transition before adding any new inputs. That is the complete cycle-breaking protocol. Evening setup, morning execution. Most people who implement all of these changes consistently notice a meaningful difference in their morning symptoms within 7 to 10 days. Not because any individual change is dramatic, but because all 4 overnight mechanisms are being addressed simultaneously for the first time. One more thing before we close. If you've implemented these changes for 3 to 4 weeks and your mornings are still consistently difficult, that is important information. It means one of two things. Either there is an underlying cause that requires a professional evaluation to identify, and a visit to your doctor or an ear, nose, and throat specialist is the right next step. Or there is a medication contributing to your symptoms that needs to be reviewed with your prescribing physician. Don't accept chronic morning throat mucus as simply part of aging. It is almost always caused by something specific. And almost always, that something specific can be meaningfully improved. You now have a complete framework for understanding your overnight mucus cycle and a specific protocol for addressing it. What you do with it tonight will determine what tomorrow morning looks like. If this video helped you, remember to type morning in the comments to get the free guide. And if you know someone who's been starting every day with that same frustrating routine, wake up, clear throat, start over, share this with them. Because understanding the overnight mechanism is the piece that finally makes everything else make sense. I'll see you in the next video.